Good morning, Lake Providence Church family. This is Dr. Linda Plummer Ward with another health ministry update. I'm so glad that you were able to join us today. Of course, we're in the midst of a surge in this pandemic, and the United States is soaring with the number of new cases and the number of deaths. There is a strong push for vaccination in the United States and around the world so that individuals can protect themselves and their families from severe COVID-19 infections and from death due to COVID-19. It's also important so that we can develop herd immunity and stop this pandemic. There's a COVID-19 variant that you may have heard about from the United Kingdom. There's also one from South Africa. I'm not sure that that one has been identified in the United States, but it probably will be soon. Both of these variants actually are more contagious, more easily spread, and will cause more cases. They have not been shown to change what we are seeing with respect to the number of deaths. However, the more cases we have, the more deaths we'll have. So, nevertheless, this pandemic is not going away anytime soon. So let's make sure that we're doing what we can to keep ourselves safe. The vaccine rollout is going very slowly. There are sites listed on our Facebook page at LPMBC Nashville Health on Facebook. So if you would go there, you can see many of the places that are offering vaccinations. They include Meharry. Vanderbilt is offering vaccinations. I know for its patients. I'm not sure if for the general public, but definitely for its patients. And there are other sites. You will find that if you go to the Tennessee State site, you will have to sign up by county, and you will then be directed to areas where you can make an appointment for a vaccine. The CDC recently changed its vaccination phases so that those age 65 and over can be vaccinated with those age 75 and over. Since we're lagging behind, it may be a bit before that actually gets done. Hopefully, the vaccination process will be improved, and we will be able to get some of these people who are standing in lines in person and in lines online vaccinated. These are trying times, and it requires that we remain prayerful. We have to guard what our eyes see and what our ears hear, because a lot of it is traumatic, and we can't erase it from our brains. It is so important to stay connected. As we struggle through this pandemic, there are those who have little family or no family, and not many other connections either. So as we continue to pray for them, find ways to connect with them. We have to remember also that many of these people also don't have technology that we use to keep in touch with each other, or the familiarity with that technology. Nevertheless, be encouraged. Continue to wear your mask, wash your hands, watch your distance, and stay away from crowds. Remember, these are not 100% safe, but they do decrease the incidence of the disease and the severity of the disease. Most people who get it will survive. We do know that there are sequelae to getting the infection. Some people have them, some people won't. But it has been shown that people can have shortness of breath, brain fog, and fatigue, including other symptoms like their sense of taste and smell may not return, especially right away. These things can last for weeks to months. And for some people, it appears to just keep going. Seems to be a persistent thing. So we have to be aware that getting the infection, even though most people survive, some people can still have problems after the time that you would think they would have recovered. We are so blessed. God kept us through 2020, and God willing, He'll keep us through 2021. It isn't natural not to be able to shake hands and hug. Regardless, be careful to practice safe habits. Don't live in fear, but live in faith. Be knowledgeable and use what you know to make wise decisions. Thank you for joining us again. Stay safe, stay healthy, and stay prayed up. Have a blessed week.